So first, I'm just going to give you a little bit of an insight as to what we've actually achieved in Scotland around digital mental health, and then I'm going to explain a little bit about the approach we've taken from a leadership point of view and the transformation that we've achieved in Scottish services. So in Scotland, we have integrated a number of key technologies across our mental health services in Scotland, and what's been key really is the integration of these technologies into our clinical service structures. This is a standard step care model that we use predominantly in Scotland around about our service development, and what we really did is target specific technologies to integrate into our services to either enhance our existing service delivery or actually deliver specific treatments. And really available across Scotland, we have a whole range of different digital offerings now within our mental health service. So currently we have 29 self-managed digital treatments. So that's predominantly internet CBT or computerized CBT, which covers a whole range of different condition groups as well as clinical populations such as perinatal, young people, higher education, but also obviously adults. We also have CBT therapy delivered through written word, which is effectively a web chat, as well as video-enabled therapy. And right at the bottom here, we have also quite a large online offering around self-help and self-management resources. Currently in Scotland, we receive around about 71,000 referrals into our digital therapy services. So I'm just going to put that in context for you. So across our psychology services as a whole, it means for every 3 referrals, 1 will be to a digital service. And we're predicting actually that the digital therapy services will become the biggest mental health service in Scotland in the next few years. Patients will wait no longer than 5 working days to access these services on an ongoing basis, and we're continuing to increase our portfolio of treatments extensively year on year. In addition to that, we have about 18,600 video consultations. That's one-to-one consultations between psychologist, psychiatrist, or nursing, and patients, as well as 150 group therapy consultations a month. In addition to that, our online self-help resources are accessed about 38,000 times per month. So you can see there's quite a large amount of activity across our digital services within the Scottish context. But what's probably more pleasing, I think, is actually the spread of services. So for those that don't know, this is a map of Scotland, and the further north you go, the more dispersed the population. And actually, our services are probably used more in our small island boards than they are anywhere else, which is really pleasing. So it just shows that the advantage of digital now is actually about overcoming accessibility issues. But just to put in context around the satisfaction levels of our services, so we have a 91% satisfaction level from our patients. So not only are the services reaching a population that we haven't been able to reach before, that population is actually expressing a real satisfaction in both treatment and the technologies we use. So just in relation to the kind of key areas that we focused on in terms of our leadership and driving the program of transformation forward. So the first thing we did was really to ensure we defined a clearly defined approach. And this really started way back by asking the right questions. And the right question wasn't around the technology we use, wasn't around what digital were we introduce and how much it cost. It was actually around the true role and purpose of introducing digital. What was the value of having digital services introduced into our mental health settings? We also spent a fair amount of time understanding the doubts, and there are many doubts when you introduce digital into any healthcare setting, but particularly within a mental health setting. And really developing a core understanding of why there are doubts is really, really key. And you can see here we've just identified a few. So some of our clinical colleagues thought it was a step too far. There was a perception that there was inferior to face-to-face services. Was there an acceptance from our patients that they could access digital? And a number of ethical issues around about the vulnerability of patients accessing these services. The only way we addressed the reasons for the doubts was to develop the right evidence and the right data to provide a kind of contextual understanding of what digital was doing within mental health services and what our patients were thinking of these services as we progressed. We took a very strong evidence-based approach, so we followed the evidence, and all our services are evidence-based to a standard of randomised control trial or to our national clinical guidance. But we also recognise the true barriers to implementation and to upscaling at an early stage. And again, these are not technological barriers, but they tend to be attitudes, perceptions, drive and commitment, but as well as developing common goals and purpose in the implementation that we're taking forward. One of the key issues that we've had to overcome is really the trust in using technology and the trust in using them with patients with mental health conditions. So a lot of our time is spent really building that trust with clinical staff, with care staff, as well as with our patients. And what's been core to this is really a level of transparency, learning together, but also developing a good understanding of what our clinicians and our clinical services are overcoming on a daily basis. We also thought it was really important to respond and react to questions, to attitudes, to negative perceptions. But really, one of the core aspects was to ensure that this was a kind of knowledge exchange process and learning together. One of the other things which was core was actually leading with ambition and not caution. And it's really important that when you're developing digital services, you don't immediately hamper it by taking a kind of minimalistic approach or pilot approach. So we introduced digital mental health in Scotland. We decided to be very ambitious and look at the genuine change that digital could bring. And that included things like improving quality of access of services, increasing patient access to evidence-based therapy, as well as addressing a lot of our geographical needs in Scotland, but ultimately beginning to reshape our services to provide more effective and efficient service delivery. The next thing that we did then was begin to develop a kind of national focus for change. The first thing that we did in Scotland was develop core leadership roles. So these are clinical roles. The example here is actually my role within Scottish Government. So my role was developed in 2020, and I act as a national advisor for policy in Scottish Government, as well as an implementation lead for digital mental health across the whole country. And really what my role was designed to do was to pull two worlds together. So to pull together a digital world and the mental health world to really begin to shape joint policy between those two areas of government. And it was really designed to act as a bridge to pull those two worlds together. And it's interesting enough, I'm not clinical. I'm actually an implementation person by trade. So it's an implementation role rather than a clinical role. So what I was able to do in Scottish Government is I'm able to advise on the right products and the right implementation approaches to develop large-scale implementation. One of the core aspects of this was also then to gain national recognition, and we have a national policy around about our digital mental health, which acknowledges the integral part that digital plays within our mental health services, but also ensures that it is balanced with a development of more traditional services as well. So there's always a balance, and ultimately this is about creating choice for patients as they move forward. And as such, we've been able to integrate a whole range of digital mental health into our policy settings. So these are a couple of our core strategies. So we have a mental health strategy, which was published in June 2023. You'll find digital is throughout that strategy. But also more pleasingly, what we're beginning to see is mental health appearing in digital strategies as well. So this again is this idea that we're sharing a common purpose and a common goal across our national policies. And one of the kind of key things about obviously when you develop a policy is you can begin to develop it into a national strategy. So we developed core services that we wanted to develop across our stepped care model and began to build the digital service offering through the national policy drive. And to ensure that this was then delivered, we also developed a national programme for digital mental health, which focused not only on digital services and the development of things like our digital therapy services or our video-enabled therapies, but also began to look at infrastructure and the changes we needed to make across the whole system to ensure that digital was maintained and became integral as part of our long-term delivery strategy. And with the development of programme, what we ensured then was that we could ensure that governance was embedded directly into the heart of government. So right here in the middle, we have the digital mental health programme. And as a consequence of where it sits within the Scottish Government, we feed in directly into the senior governance structures within our digital health and care, as well as within our mental health directorates. And what this ensured was not only a high visibility of the work we did, but also ensured that we're balancing the digital requirements with the mental health requirements moving forward and ensured alignment across a whole range of activities. What we're able to do was also then increase our membership to ensure that we had the right leaders around those tables and begin to encourage individuals not only to work across government, but then to take that leadership into our territorial areas. One of the kind of core things that we've done and spent a fair amount of time on is really changing culture. And this has been really key to the success that we've achieved in Scotland around our digital mental health services. So the first thing is we've built change over time. And it was really interesting hearing Klaus speak earlier on. I've been doing this for 20 years. Klaus has been doing his for 30 years, so I guess he trumps me slightly. But it's really interesting because what we've been able to do is build slowly, incrementally over many, many years to really build that change and that transformation into our systems. We've been able to develop strong partnerships, and partnerships across a whole range of stakeholders, from our healthcare providers into our national boards, such as Education Scotland, which is workforce development, into primary care, third sector organisations, but also into government and policymakers. And what these are genuinely long-term partnerships, where you work collaboratively together to find a common goal and a common purpose of development. And across these partnerships, we have a shared responsibility, which allows us to create ownership. And this has been really key because what we've been able to do is to share strategic alignment, but also then ensure that we're maximising the skills of each of our partners to achieve as much as we possibly can. And that really means, in essence, that we're using clinicians in the right way, we're using information governance in the right way, but we're also using our technical experts in the right way across our Scottish mental health services. We've driven adoption through this cultural change process. And really what it's required us to do is to have a continuous engagement and promotion activity around about our digital mental health services. And when we designed our engagement, we really focus on things like negative perceptions or attitudes towards digital. We aim to build a much greater knowledge of what digital is doing and what it can achieve within our mental health settings. And everything we do is underpinned by good data and strong evidence of what we try and achieve. And ultimately, through this engagement process, what we've been able to achieve is much greater usage levels across our digital mental health services, a wide level of acceptance, but most importantly, I think we've developed motivation in our mental health services to use digital, as well as integration of digital genuinely into our clinical settings. One of the other things that we did right at the beginning is we decided to focus on building proper, sustainable service options within our mental health that were digital. And this became really key because, as anyone working with healthcare will realise, it takes a long time to develop services. But what you have to do is you have to give people hope and belief that these services are going to be there for the long term and they're going to genuinely have the impact. So what we've done in Scotland is we spent a lot of time building our infrastructure and building our long-term capabilities of delivering digital. And as such, just a couple of examples that we have is we have a national innovation cluster, which will look at new technologies and how to integrate them into our healthcare settings. But we also have a national evaluation structure, which maintains our data as well as integrating into research. And lastly, one of the big things that we did is we genuinely celebrated our successes. So Klaus isn't in the room, but he won't thank you for this, but this is the graph that we had when we were involved in the Mastermind project many years ago. And this graph is effectively the reason why I have national funding today. So the little green bar, if you can see Scotland, second there, green bar is what we had to achieve, and the black bar is what we achieved. So just the comparison against other European countries was enough to convince our policymakers and our funders that actually digital had a lot to offer in Scotland. That's me. Thank you very much.